I'm Helen Leighton, the community staff nurse at Leicester City. Palliative care is important because it allows people to live before they die. It makes sure that loved ones stay together. It allows the patient the opportunity to die in the place of their choice, and it makes sure that symptoms are well controlled and that distress, where possible, is kept to a minimum. It allows somebody to have a good death. As a community nurse, being involved in somebody's care at the end of their life is a huge privilege. Being allowed into somebody's home as they're going through the terminal phase of their illness is quite humbling. The skills and qualities of a palliative care nurse are being a good communicator, being open and honest, being able to undertake a full holistic assessment, being compassionate, patient and calm in any situation. To me, dignity and compassion in end-of-life care means allowing somebody to have a good quality of life while they're still alive, allowing them to choose where they'd like to die, making sure that their symptoms are well controlled and that their loved ones are with them. As a community nurse, I think I make a difference by providing continuity of care. This allows to build a close relationship with your patient, and this often allows them to share things, feelings and fears that they wouldn't with anybody else. By working within a multidisciplinary team, I also can act as a signpost for my patient, allowing them to have streamlined care and the appropriate agencies in at the appropriate time. One of the examples where I think I made a difference was one of my patients was in the terminal phase of cervical cancer, and her daughters wanted to look after her. None of them had been trained in any care setting, and I simply went in and showed them how to roll the mum to make sure that she didn't get pressure sores, how to use the slide sheet to position her within the bed, and that liberated them really to care for her exactly how they wanted to be cared for, how she'd expressed she wanted to be cared for. And while it may have seemed so simple at the time, I know it made a huge difference in that situation. By coming to DMU and studying the palliative care module, I believe it has helped me develop my assessment skills by understanding the disease process more clearly. I understand more how end-of-life drugs work in the body, and also I believe ultimately it's built my confidence as a palliative care nurse. The benefits of LAUROS and DMU working together will be far-reaching, I believe. LAUROS is a very valued centre of excellence in palliative care, and DMU has a strong school of nursing. When working together, I think these will inform evidence-based practice for all nursing students, whether pre or post-registration. This will enhance all palliative care in all settings, and when all said and done, that will ultimately benefit the patient.